happy to introduce Adam Sobel, who is the founder and CEO of CareBand. Adam, thank you so much for being here tonight, and we look forward to hearing about your company.
Thank you so much for having me. Let me share the screen. Can everyone see that? Good? Great. So hi, my name is Adam Sobel, and I'm the founder and CEO of CareBand. At CareBand, we're dedicated to improving the quality of life and standard of care for people living with dementia. Did you know that there are 6 million people living with dementia today in the US, and that number is expected to double in the next 10 years? Before I started working on CareBand, I had no clue how many people were affected by dementia, nor did I know how terrible the solutions were to keep people with dementia safe today. There are a number of worrisome challenges around that people living with dementia face, but the largest and most concerning is typically wandering. 60% of people will wander at some point during their time living with dementia. The challenge is you don't know who's going to wander or when they're going to wander, and the only indicator you have is if they've wandered before. Today's systems in senior living for detecting wandering and keeping seniors safe is terrible. They often produce false alarms when people go near a door, resulting in desensitizing staff. Staff can't keep track of everyone, and the staff is really overworked. And the current technology is 30 plus years old and stops at the door, leaving staff to figure out who left and where they went. And it gets worse. Once a family learns of one of these incidents, the facility is faced with massive settlements and fines. The average settlement is about $400,000. With them getting as high as $5 million in case of a death. There's also a significant reputation damage that occurs with the facility because nobody wants to put their mom or dad in an unsafe facility. Today, there are no competitors who offer outdoor location tracking for this market. The legacy players such as WanderGuard and Accutech do have door alarms and lock the doors when somebody gets close, but due to fire escape laws in most states, those doors can't stay closed for more than 15 seconds. Additionally, if the door is not a door with a lock or alarm on it, such as a lobby, you're frankly out of luck. You may think it's crazy, but another issue is that because visitors come in often and have no clue who has dementia and who doesn't, oftentimes people leave the building simply because somebody let them out. Over the past few years, a few new companies have emerged, including CarePredict and Blue Willow. Blue Willow came in, got into about 100 facilities, and then was acquired by Philips. Clearly, there's an opportunity here to change the way things have been done and make it better for everyone involved. CareBand provides a complete solution for improving the quality of life and standard of care for people living with dementia. It starts with our room-level location tracking. With this, we can understand where a person is 24/7, whether they're in their bathroom, their bedroom, or their kitchen. We're also developing algorithms to capture activities of daily living. For example, we can understand that somebody is in their bathroom, but then we can also understand that they brush their teeth and wash their hands, providing more context to that situation and being able to detect when something is out of their normal behavior. For wandering and wander management, the system is simple. As a person is approaching a door, an immediate notification is sent to caregivers via text or call. Once they're outside, our patented hybrid location tracking turns on and is able to detect where a person goes. Another notification goes to caregivers sharing their exact location and path so the person can be found quickly and safely. At this point, you're probably wondering, why can't the Apple Watch or any other GPS tracker do this? And why is this problem so hard? The challenge that we found in approaching this problem 5 years ago was that it's a problem that limits a lot of other senior care startups today. It's all around connectivity. For the Apple Watch and Fitbit and many remote patient monitoring devices today, they rely on a user to have and know how to operate a smartphone or at least have Wi-Fi. In reality, many senior living communities today don't have Wi-Fi, and people living at home might not even have Wi-Fi. Additionally, many seniors don't know how to use a smartphone. The only other option is to use cellular technology, but it's expensive and extremely power hungry. For example, if you're using Google Maps on the highway, your phone can die pretty quickly if you don't have it plugged in. CareBand's different. Our core technology uses a new communication protocol that enables small amounts of data to travel extremely long distances while remaining affordable. For example, one gateway can reach 1 mile around a building or a home, provide connectivity to 1,000 devices, and only cost $300. It's truly a game-changing technology. But don't just take my word for it. In the past year, some big guys have started to take interest in this technology too. For example, in the new Amazon Echo, this technology is already included. These players provide CareBand the opportunity to leverage this network and sell across the US. We're now in growth mode and have significant traction behind us. On our sales side, we've been talking with the second largest legacy wander management company with access to 5,000 senior living communities for a channel partnership. He's been looking for this kind of technology to provide outdoor location tracking and has been impressed with what we've been offering to him. Beyond this, we're selling through system integrators, value-added resellers, and direct. Being a first mover in the long-range connectivity space, we've already filed and have been granted 3 patents and have 5 pending. On the research side, we've been awarded 4 NIH grants and have been working with outstanding research institutions focused in dementia care. Our research spans from detecting agitation in people with dementia to empowering people to age in place in rural and indigenous communities. Today, we're seeking $500,000 to complete our platform development and convert the second largest legacy provider into a partner. We believe that with this channel, we can ramp up our production and scale to at least 40 communities by the end of 2021. With revenue coming in from these senior living facilities, CareBand can focus our attention on the $2 billion opportunity of people living at home with dementia. We have a very strong team and experienced team supporting CareBand, and I'm very excited to continue our important work of keeping people living with dementia safe. Thanks so much for your time, and I look forward to our conversation.
Adam, thank you so much for telling us about CareBand. It sounds like you guys have some great early traction, which is awesome. You actually answered one of my questions, which is why can't the myriad of products out there in this band and watch space right now do what you're doing? So maybe talk a little bit more about your IP and what makes you special.
Yeah, so just to share a little bit there, I think the connectivity here is a big problem. We've seen a lot of remote patient monitoring devices try and get to the home, especially with COVID, and been unsuccessful. So I feel that the IoT technology that we're using is quite valuable in avoiding a lot of those problems, especially in the senior population. From the IP side, like I mentioned, we have 3 patents already. We're also expanding to the EU and have a patent pending there. These patents cover our hybrid location tracking, so being able to do indoor location tracking and outdoor location tracking, and that transition of technologies. We also have another patent around, we have a band that locks to keep the device on someone, so we have a patent around that. And then we have another big one that's pending that's focused around detecting early changes in behavior and changes in health based on the different behavior patterns that we're able to collect.
Very cool. You actually, again, answered one person's question, which is how do you keep seniors from taking it off? But it sounds like there's a locking device. Do you want to talk a little bit more about that?
Yeah, so there's 2 methods today. One of the things that we found early on in our research is that people give those life alerts, those panic buttons for their parents, and they wear them when their parents are around, and then they put them in a drawer when they're not around. And so what we decided to do was build in a sensor on the device to know if someone's wearing it or not. So that was our first mitigation. So we know if someone's wearing it and how long they've been wearing it throughout the day. And then the second is for people with dementia, we have instead of a watch clasp, we have a 2-handed lock basically that requires somebody else to take it on and off. So there's 2 hand motions that have to happen for the device to actually come off of somebody.
All right. We have a couple more questions from our audience, which is exciting. One question around a practical piece. How does this device get powered or recharged?
So the device today has between a 3 and 5 day battery, depending on use. It uses wireless recharging, which was another kind of learning that we had early on, that seniors have challenges like plugging their iPhone in or with cords. So we have wireless recharging where you just stick it on a mat for 30 minutes and it recharges. In the senior living environment, we chose 3 days. Initially, a backstory here, initially we had it at 30 days. And we thought that was outstanding. It was very cool technology, but we took it to our customers and they said, very cool, but we're going to forget to charge it. If it's not in our workflow, we're not going to be able to do it. So we argued and went back and forth a little bit, and then finally found this 3 days, really because in most facilities, 3 days is kind of when they do other things like charge hearing aids or clean glasses or take showers. So it kind of fits on their workflow, and they can work with it.
Very cool. A question partially from me and partially from someone in our audience. I'm guessing there are other potential uses for this technology and CareBand. And one question from so I'd love to learn more about that, but one question from our audience around, can the device detect falls?
So I'll do the falls and then talk about the other applications. So again, initially we built the fall detection into the device because everybody asks about falls. And we took it out to the market and we actually deployed it in one of our facilities. But what we learned was that the customer doesn't actually want to detect falls. A lot of senior living facilities find it as a liability instead of a plus. For if we detect a fall and they don't do anything, or we don't detect a fall and they don't do anything. So there's a liability on both sides. So for everybody's benefit, for this market, we decided to take it out. For the at-home market, we're thinking about putting it back in, though. And then the other question was around other applications. Is that right?
Correct.
Okay. Yeah. So what we learned was that the technology that we built was built around all these constraints. So that there wasn't Wi-Fi and cellular. We couldn't use that. And that we needed to have a long battery life. And needed it to be really easy to set up and really cheap. So what we learned was that those constraints actually have a lot of other applications in other industries. So we've been talking to a number of folks in healthcare, as well as in manufacturing and dog tracking and all kinds of places to think about how the technology in the system could be used in other applications.
Great. I'm going to end with one final challenging question for you, I would say. So from our audience, has anyone on the team had a family member in assisted living and have firsthand experience with managing someone with dementia? And then the follow-up to that, they feel like the facilities could have had this technology potentially 10 years ago and it's not pervasive. So why do you think facilities would change their model or business case for this product?
Yeah, so on the first one, so my grandmother has dementia. She has gone in and out of facilities. She's at home right now, but we would like to put her back in a facility. So that's been challenging, especially around COVID. The other thing around that, I'm very fortunate to have a team of advisors, about 8 different advisors, and a lot of them join the company, as well as team members join the company because they all have, a lot of them have a personal relationship to dementia. So it's an interesting thing to have people who have great expertise and experience, but also have that close connection to the cause. And then the other question, repeat the other question.
Sorry. The question was around, or just a challenge, I would say. Facilities could have had this technology 10 years ago and it's not pervasive. Why do you think they would change their model or business case now for this particular product?
So I think facilities are starting to change the way they think about caring for people with dementia. In recent years, or in years up till now-ish, you know, when somebody wanders, they usually just stick the person in a locked memory care unit, and that's where they live for the rest of their life. The reality is that when they're in those units, their quality of life decreases significantly. Disease spreads more easily, and that person might not even be at that level of cognitive decline that they need to be in that kind of an environment. So there's a new frame of mind around either dementia-friendly living or just dementia-empowered living that enables the person to live in a place that they want to live in for as long as possible, and to continue to have as much freedom as possible. So with our technology in an assisted living environment, you can expand to allow somebody to have freedom while having oversight and understanding of their behaviors, and see potentially when there is cognitive decline and then make a change then. Instead of just kind of automatically going to, we're going to go to a locked unit. So I think there's a change in the environment today.
That actually makes a lot of sense. And again, Adam, thank you so much for being here tonight and for sharing all about CareBand with us.